Okay, so have you ever gotten your car detailed? You know, that deep clean where they get into every nook and cranny?
Mm-hmm.
We should probably be wishing for that kind of attention at the dentist.
Yeah,
Because we're talking kids' gum disease today,
right.
and you're about to find out their mouths are way more complex than we might think.
Yeah, it really is fascinating. For a long time, we focused on teeth, but it's the entire environment that matters. Think of it less like chompers in a row and more like a coral reef teeming with life.
A coral reef.
Some of it helpful and some
Wow,
not so much.
that's way more interesting than how I usually picture a mouth. But I guess it makes sense. There's a whole lot going on in there.
Right.
So are you saying we want bacteria hanging out in our kids' mouths?
You absolutely do. Some bacteria are like the good guys, breaking down food, even fending off the troublemakers. It's all about balance, like a well-tended garden. The problems start when, well, imagine dumping a bag of fertilizer on only the weeds.
Yikes. Talk about a recipe for disaster. And I'm guessing things like not brushing properly are that fertilizer.
Right? Exactly. That's when plaque, that sticky film, builds up. It's basically a luxury condo for the bacteria we don't want, setting the stage for gum disease.
And if plaque sticks around long enough, it hardens into tartar, which is like cement for those bad bacteria, right?
A very accurate comparison. And no matter how awesome your kid is at brushing, tartar removal, that's a job for the dental pros. This buildup is what kickstarts gum inflammation, the first stage of gum disease, also known as gingivitis.
Gingivitis.
Yeah.
Okay, that rings a bell. But I have to admit, before this deep dive, I kind of thought of all gum issues as, like, the same.
It's a common misconception. Gingivitis is like the warning light on your dashboard, a signal to take action. Catch it early, and it's often reversible. But if ignored, well, that's when things can escalate to periodontitis, which is a whole different ballgame.
And that's the point of no return, right? Where it's serious damage.
Not necessarily no return, but definitely a much bigger deal to address. And you'd be surprised by what can increase a child's risk. We're talking crooked teeth, dry mouth,
Yeah.
even puberty can play a role.
Wait, puberty? Okay, now I need details. Teenagers have enough to deal with. Now their hormones are messing with their gums, too.
It sounds strange, I know, but those hormonal shifts during puberty can make gums extra sensitive and prone to inflammation. Remember, we're talking about a delicate ecosystem here, and even slight changes can throw things out of whack.
So it's like how some teenagers suddenly have to deal with oily skin and breakouts. Their poor mouths are going through it, too.
Exactly, and those breakouts in their mouths, that's basically what gingivitis is. Red, swollen gums, bleeding easily, especially when brushing. That's your clue that something's off.
And that morning breath, even after brushing, that's not just them trying to get out of chores.
Could be a sign. Now, periodontitis, that's where those scarier symptoms show up, gums pulling away from teeth, even loose teeth in severe cases. Imagine your gums receding like a shoreline. Not a good look. And it exposes the roots, making them vulnerable.
Okay, now I'm picturing some kind of dental horror movie. This is why regular checkups are so important, right?
You hit the nail on the head. Regular checkups are like taking your car for a tune-up. You're much more likely to catch a problem early on when it's a quick fix rather than a major overhaul.
So let's say the dentist does find a problem. What happens then? It can't be as simple as telling a kid to brush more, right?
Well, brushing better is always a good start, but you're right. It often requires more than that. For gingivitis, a professional cleaning, often called scaling and root planing, might do the trick. Think of it as a deep clean for your gums.
So it's like finally getting around to cleaning out of the couch cushions where all the crumbs have been hiding.
Exactly. Scaling removes all that built-up plaque and tartar, while root planing smooths out the tooth roots, making it harder for that gunk to accumulate again.
And for kids especially, making that experience as painless and stress-free as possible is key. Nobody wants to go back to a place that freaks them out, right?
Absolutely. Pediatric dentists are rock stars at making kids feel comfortable. They use all sorts of kid-friendly tools and explain everything in a way that puts even the most anxious child at ease. But in some cases, even with the best cleaning, they might need a little extra help. That's where antibiotics come in.
Okay, antibiotics. That sounds a little intense. Is that really necessary for kids?
They're definitely not the first line of defense, but they can be very helpful in knocking out particularly stubborn bacteria, especially in more advanced cases of gum disease. Of course, anytime you're talking about antibiotics, it's important to weigh the benefits and risks carefully.
Right, you don't want to be throwing antibiotics at every little thing.
Exactly. A good dentist will always take a conservative approach, opting for the most gentle yet effective treatment plan. And the good news is, even in serious cases, gum disease can be managed with proper care. It's never too late to turn things around and preserve those precious smiles.
That's reassuring to hear. But of course, preventing gum disease in the first place is always the ideal scenario.
Absolutely. An ounce of prevention is worth a pound of cure, as they say.
So let's talk practical tips. What can parents and caregivers do to keep those little mouths healthy?
Well, first and foremost, make oral hygiene fun. Brushing and flossing shouldn't be a chore. There are some amazing kid-friendly electric toothbrushes on the market these days with fun characters and colors.
And don't forget the flavored floss. I'm a sucker for the bubblegum flavor myself.
Me too. It's all about making it enjoyable. And remember, consistency is key. We're aiming for brushing at least twice a day for a full 2 minutes each time, and don't forget to floss once a day.
Okay, we've covered brushing and flossing, but we can't ignore the elephant in the room, sugar. Kids love it, but it's public enemy number one for teeth. How do we manage that?
It all comes back to that bacterial ecosystem we talked about earlier. Every time your child indulges in sugary drinks or candy, it's like they're laying out a feast for the bad bacteria in their mouth.
So we're fueling the very villains we're trying to fight.
Exactly. Now, I'm not saying we need to banish sugar completely. Let's be realistic. But we can definitely make a difference by limiting sugary drinks and processed foods, and instead offering healthy snacks like fruits, vegetables, cheese, and yogurt.
So instead of feeding the villains, we're giving those superhero bacteria what they need to thrive.
Precisely. A healthy diet, along with good oral hygiene, can go a long way in preventing gum disease.
And of course, those regular dental checkups can't be stressed enough.
Absolutely. It's all about early detection and prevention.
Speaking of prevention, I read in one of our sources that neglecting gum health is like ignoring a small crack in your car's windshield.
Ah, yes, that's a great analogy.
It's one of those things you don't think is a big deal at first, and then, bam,
Right.
you've got a spider web of cracks obscuring your vision.
And a much bigger, more expensive problem to fix. Those early signs of gum disease, a little bleeding while brushing, maybe some redness, those are the tiny cracks. Ignore them, and you're setting yourself up for more serious issues down the line.
Okay, that's a visual I'm not going to forget anytime soon. So as we wrap up our deep dive into this surprisingly complex world of kids' gums, what are the key takeaways you hope listeners walk away with?
The biggest one, gum disease is preventable. Good oral hygiene, healthy eating habits, those regular dental checkups, they're like superpowers for your child's smile.
And if you do notice those tiny cracks, don't freak out, but definitely don't ignore them either.
Exactly. Early detection and treatment are key. Just like with that windshield, it's much easier to fix a small problem than wait until it becomes a major headache.
We've covered a lot of ground today, from that incredible bacterial ecosystem in our mouths to the surprising link between puberty and gum health.
It's pretty amazing, isn't it?
Who knew? But most importantly, we've armed you with the knowledge and hopefully the motivation to make those small but significant changes that can protect your child's smile for years to come.
It's been a pleasure diving deep into this with you.
Likewise. And to our amazing listeners, thanks for joining us on this deep dive. We hope you learned a thing or two and feel empowered to take charge of your family's oral health.